My name is Monica Nandan, and I am the Director of Strategic Partnerships and Social Impact for the Wellstar College of Health and Human Services. My very diverse and cross-continental academic background, training, along with experiences in accounting, finance, service marketing, healthcare, gerontology, and social work has taught me one thing for sure: how much I do not know. It has also taught me to view issues, situations, problems, challenges, and opportunities from different angles and perspectives. Challenges and opportunities are like a kaleidoscope, constantly changing based on the vantage point one is looking from. Academic and work experiences have also taught me to naturally think in inter- and transdisciplinary manner, which has influenced my two research themes and orientations. One, interprofessional collaboration, and second, social innovation and entrepreneurship. I work with disparate interprofessional and interdisciplinary teams at Kennesaw and outside, and as we embark on projects, we uncover other layers of the onion that need to be understood and addressed simultaneously. Hence, several projects and research endeavors are occurring concurrently with students and faculty from different disciplines. Particularly, I would like to share 3 research or grant projects.
I will first discuss the details of a grant-funded research examining the mental health of academically high-achieving high school students. Second research project is understanding mental health help-seeking behaviors of college students. And the third research is identifying potential mental health cases from police incident reports, since all first responders code the 911 calls differently. The first research project used human-centered design thinking methodology to collect data from high-achieving high school students that led to the development of a nonprofit called Youth-Centric.
A philanthropist provided funding to research the emotional well-being of school students, particularly high-achieving students, wherein graduate students from 5 different disciplines at KSU, they used design thinking tools and social innovation orientation to collect data from over 200 school students to help build the infrastructure of a nonprofit called Youth-Centric. To help design the details of the center, we hired undergraduate students from several other disciplines to brainstorm and prototype ideas that will be fleshed out further with the professional architecture, board members of organization, and program staff. The second set of research I would like to share builds on this previous research I just shared. In our community engagement efforts, we have learned that there is a tremendous variability in the help-seeking behaviors of individuals from diverse backgrounds. Our study is available on Georgia Department of Public Health website titled Georgia OPID Strategic Planning, Multicultural Needs Assessment, and speaks to help-seeking behaviors and recovery journey of individuals from Latinx, African American, elderly, college, veteran, LGBTQ population, along with individuals who are unhoused. Another related study was on college students' help-seeking behaviors in particular and access to care for mental health. There is limited research on online help-seeking behaviors, let alone specific research on college students' online help-seeking behavior. This study identified terminologies that college students utilize with online search engines to seek assistance and/or information related to mental health. The most common words used by college students is in the realm of just mental health or mental health help, and some of them use symptoms and diagnosis, which are mostly women students. Some others use either cost words or insurance words, also commonly used by students. Additionally, as a facilitator of a community coalition interfacing with first responders, which is police, fire, 911, in collaboration with several faculty from Wellstar College and Coles College, we are trying to understand how first responders respond to 911 calls that have a behavioral health underpinning. We've also learned in this endeavor that the codes used by 911, fire, EMS, dispatchers, and police are not consistent. Hence, at this point in Georgia, and probably nationally, we are guessing the number of behavioral health related calls received by 911 and responded to by police and fire. These community collaborations are giving rise to several questions concerning the issue of mental health. How these professionals respond, what occurs at the site, how many calls occur each year, what is the disposition of these calls. Consequently, we have signed a memorandum of understanding with the county government to receive copies of over 50,000 cases from police incidents reports to answer these questions. We are using neural network analysis, algorithms, and primary coding by hand to see if we can uncover patterns in the data that can help predict the incidence of potential behavioral health calls. We have identified over 180 codes so far and grouped them into categories of diagnosis, behaviors, medications, and crimes. The purpose of all these projects are to engage in collective impact thinking, use and build a system architecture design for behavioral health, travel upstream in the behavioral health space, and be proactive. Connect the nodes of different systems in primary, secondary, and tertiary prevention in behavioral health. Finally, to guide local and state policies where possible to enable better design and delivery of services in the behavioral health realm. I'm truly grateful and indebted to my KSU faculty partners, students, particularly GRAs, as well as global collaborators on projects we have completed together and are completing. Without the shared vision, passion, and contributions of each one of the partners, we would not be sharing the timely nature of our research endeavors today.